Welcome to Cardiovisual. My name is Michelle Rothenstein, and I'm a registered dietitian, a certified diabetes educator, and preventative cardiology dietitian. Today I want to talk to you about nutrition and heart failure. Heart failure is when our body cannot pump blood efficiently throughout our body. To learn more about heart failure, please visit the video on the Cardiovisual app called Understanding Heart Failure. From a nutrition perspective, we want to optimize and reduce any burden that we are putting on our body so that we can help our heart pump blood more efficiently. It's important that we know your actual body weight when it comes to heart failure, and sometimes it might be a little bit hard to figure that out. So we want to assess your dry weight, meaning your body weight without that water retention. It's important that you get to an ideal body weight that fits for you, because the more excess weight you have on your body, specifically around your abdominal region, the harder it is for your heart to work. So heart failure and your body's ability for your heart to pump blood will be harder if you have excess body weight. To learn more about what the right body weight is for you and some nutrition and weight loss diets that may work for you, please visit my previous nutrition videos. Because your heart is not pumping blood efficiently in heart failure, it can lead to salt and water retention. So the first thing that I want you to pay attention to is your fluid gains. You should be going on the scale every day in the morning before you eat anything without clothes on, and assessing your weight. If your weight jumps 3 pounds in 3 days, there is a sign that you can actually be retaining water, and it's something we need to address. As a general rule of thumb, we want to limit your liquid consumption to 1 to 1.5 liters per day. We also need to make sure that the salt that you're consuming, the sodium that you are adding in or that's found in many packaged foods or in restaurant foods, is limited to about 1,500 milligrams per day. Research shows that heart failure decreases our antioxidant defense systems, so we need more antioxidants to quench the free radicals. When we have too many free radicals and not enough antioxidants, our body increases inflammation, increases oxidative stress, and causes more risk of heart damage and heart attacks and strokes. So we need to optimize these pathways. And the best way to do that is to include certain nutrients that help increase glutathione and improve the SOD pathways. Specifically for glutathione, we want to increase cruciferous vegetables, allium vegetables, and the nutrient selenium. Cruciferous vegetables include things like Brussels sprouts, broccoli, cauliflower, arugula. Allium vegetables include things like onions, shallots, and garlic. Selenium is really found in different fish and also in Brazil nuts. The other antioxidant pathway that we want to enhance is the SOD pathway. And we do this by including foods that are rich in manganese, zinc, and copper. Foods rich in manganese include whole grains and leafy green vegetables. Foods that are rich in copper include things like mushrooms and dark chocolate. And things that are rich in zinc include things like chicken breasts, pumpkin seeds, and oatmeal. I want to touch base upon certain medications that are commonly prescribed in heart failure because they're super important from a nutrition perspective. So for instance, a lot of people are prescribed furosemide, which is a loop diuretic that can cause a decrease in magnesium, chloride, and potassium. So we want to make sure that if you're on furosemide, that you are still obtaining these nutrients from your diet. It also, furosemide can have a negative impact on bone homeostasis and cause a decrease in calcium absorption in your bones. And so we want to make sure that we are addressing all these factors. Just as a brief overview, magnesium is found in nuts, seeds, and beans and legumes. And your potassium is really found in a lot of fruits and vegetables and in some whole grains and legumes as well. So please work with your individualized care team to ensure you're getting all of these nutrients. These nutrients are super important because they actually help your body pump blood more efficiently. And when you have heart failure and you become deficient in these nutrients, it can actually be more detrimental than positive. Another medication that a lot of people are prescribed is called spironolactone, and that's actually a potassium sparing medication, which means that your body can hold excess potassium in your body. So we need to make sure that you're not having too much potassium, but you're having the right amount to optimize that balance. I want to make sure that if you are on certain medications, have a conversation with your physician, have a conversation with your registered dietitian to ensure that you are getting all the nutrients you need to optimize your diet. I also want to just say briefly that it doesn't mean, okay, well, if I take these medications, should I take a supplement with it? It actually could be more harm than good by taking a supplement with it, because certain medications and supplements interact with each other and can cause an excess amount of toxic load in your body. When we get it from natural food, our body is very efficient at eliminating the nutrients that we no longer need and keeping the ones we do. So it's best to get it through food, through a well-balanced diet. When we look at the research for the best diet for heart failure, we see that the Mediterranean diet and the DASH diet, which are very similar to each other, are the most beneficial, especially in decreasing overall death rate of heart failure. One of the reasons why the Mediterranean diet and the DASH diet are also really helpful in reducing risk of deaths from heart failure is because it's helping control other risk factors that you might be having because of heart failure. So in order to reduce that burden on your heart, we need to make sure that we are optimizing your blood pressure, optimizing your blood sugar levels, optimizing your cholesterol levels through appropriate nutrition and lifestyle medicine. To learn more about the Mediterranean diet, please check out my other nutrition video called Nutrition in Common Weight Loss Diets to learn more. I hope this video was really helpful to you, and I look forward to seeing you in the other videos on the Cardiovisual app. I want to emphasize though that this is general advice and it is not personalized advice. So please consult with your team that includes your cardiologist and your registered dietitian who specializes in heart disease to ensure that these recommendations is personalized to you, your medications, your medical history to ensure optimal care.